Hello, everyone. Dr. James Marcum with another biblical prescription for life. I thought after all these years, I might be nearing the end of talking about pandemic-related issues, but another one has come up today. And I think it's time for me to talk about this. Well, what time is it? Is it time to talk about these things? The question is this. It's been asked, and I think it's time to answer this question. Should the mRNA vaccine be removed from the market? This is a vaccine that it's been estimated that 81% of people took. So it's affected many, many people. Should it be moved off the market and no longer given? I feel like it's time to answer that question. But more importantly, it's time to go to our Bible text and see what God is saying to us today. And this is from Matthew 23, verse 11. But he who is greatest among you shall be your servant. Your servant. Well, all is not well related to the COVID pandemic. All is not fine. In fact, recently, not too far from where I live, a tragedy happened at the Centers for Disease Control in Atlanta. I'm sure many of you have heard about what happened. A gentleman started firing shots into the building. He killed one person. Then in the aftermath, they're still sorting through things, but this was a tragedy and it scared many people. One person died. That is unacceptable. So everyone's playing the blame game now. Many people say, well, this guy is doing it because he's an anti-vaxxer. Others are saying, no, he wasn't an anti-vaxxer. He was one that had been hurt by the vaccine. He was vaccine injured and he had mental health problems. Well, the blame game is not solving anything, and it's time to quit doing that. It's time to get real answers. And one of the first things that we should do is make up our minds, should the mRNA vaccine be removed from the market? Many are saying yes. Well, there's 81,000 medical doctors, scientific people, citizens who signed different petitions. There's 240 elected officials, 17 public health officials, 6 global studies. All these say, yes, it's time to remove it. I want you to weigh in today below. Give your comments. It's time for you to take a stand. After evaluating everything, what is in your heart? What is in your heart? What do you think should be done? Should we keep playing the blame game? What should we do? Well, who said no? Well, Moderna, Pfizer, the other pharmaceuticals, okay? Those people that said, let's follow the science, and we've already known that science isn't always accurate. The science in the Bible is, though. Those that censored other people, those that demarginalized other people and professionals, including fellow colleagues and their families, those that would not have any debate on the issues, those people, a lot of them said no. Those that said that refusing the vaccines created dangers for others and were societal threats, all of those people probably are still saying no, the mRNA vaccines should not be removed. But it's time for you to weigh in today. What do you think? Should the mRNA vaccines be removed? What's the evidence that you have one way or the other? Well, I've been studying this for quite a long period of time. And, I've talked about spikeflammation, and you can learn about that at my heartwiseministries.org website. The spike protein is not a good thing. Triggers all sorts of immune reactions. Different bodies react different ways. Then there was all the talk about the lipid nanoparticles. Then there was talk about biodistribution. Remember, originally it was supposed to stay in one part of the body, and then they found out that it went in many parts of the body. Then there's the issues with things like genetic contamination. Certain batches were contaminated. Then, now, post-pandemic, we've seen tons of studies. Here's a study by Faxova that looked at 99 million people, and it showed that those people that had 2 doses had a 510% chance of having myocarditis. It's been admitted now that that's a problem. Brain clots, Guillain-Barré, spinal cord inflammation. Here's another study by Karimi looking at 85 million different doses. Heart attacks up 286% after the second dose. Stroke, 240%. Coronary artery disease, 244% after the second dose. And it goes on and on in these studies. Everyone almost knows someone that has a vaccine-associated adverse reaction at this point. So the problems at this point in thinking about this issue, should the mRNA vaccine be continued? One, the virus is mutating. It's constantly changing. It's a target we can't hit. The new vaccines just aren't hitting it. The new vaccines, remember, the viruses are now they spread easily, but they're not as dangerous. They're more virulent, but not deadly. And we're trying to make mRNA vaccines on something that's mutating very quickly. Many people out there, me included, have natural immunity. We never had the mRNA vaccine. We never got COVID because we had natural immunities. Our bodies were exposed to it. The safety to this date, many people do not think the safety has been fully evaluated. The VAERS report system would support this saying. And in fact, there are so many VAERS reports, previous vaccines, if this many people reported adverse reaction, they would have been gone. If a medicine would have reported this many adverse reactions, it would have been gone. This one is still not gone yet. We've noticed for sure that the more dose, the more side effects, and yet we still are recommending mRNA boosters. We still have not had great studies or know what the mRNA is doing long-term in the body. Some studies have shown what we call genetic integration. And here is a study that talks about genetic integration, synthetic mRNA vaccines, and transcription dysregulation. That's how the DNA makes proteins that govern our bodies. There's numerous studies that are saying that the mRNA might disrupt genetics. We do not know if it's short-term or permanent, or it's going to continue to make spike protein in more people. But remember, there's still studies coming out. A new Swedish study looking at 1745 healthcare workers found that those that took the mRNA vaccine, 70% had flu-like symptoms, 50% lost their jobs. If that wasn't enough, there's been 7 negative efficacy studies showing it doesn't work, 11 DNA contamination studies, 12 studies that have shown excess mortality in those that took the mRNA vaccines, and yet we still haven't made up our mind. It still hasn't been time to take it off the market. Well, what is the Health and Human Services doing? Well, they're making some movements now as if they're thinking about doing something, but they still haven't done it. Well, what have they done? They've canceled BARDA, and that's a contract with a lot of different people that help with the vaccines. It involved $500 million. They canceled that contract. They stopped federal funding to incentivize hospitals and doctors to make mass vaccination policy. 36,000 doctors had Medicare reimbursement changes based on the vaccine rates. And then they're now looking at these vaccine courts that has $4 billion in surplus. They haven't even tackled some of these mRNA vaccine issues. So the HHS is doing something, but no one has taken the time to address this final question. Should the mRNA vaccination be pulled off the market at this point based on everything that's happened, all the data, all the movement? Is it yes or is it no? How much longer do we have to continue with this? How much further evaluation do we have to have? What are the risks of the mRNA vaccine? We've talked about them, but at this point, what are the benefits? What are the benefits in most people who are young and healthy that have natural immunity? What are the real benefits to this? Are we creating another chronic disease, an mRNA vaccine, a spike inflammation chronic disease? Remember, 81% of people have it. Are we creating another disease which is going to create more interventions? Well, culture, the pharmaceutical industry, if we look over history, culture, obesity, guess what? We have medicines for that. Diabetes, type 2 diabetes, much of it's reversible. We have medicines for that. Mental health problems, they're increasing. We have medicines for that. Well, it's time to do something different. It's time to answer the reason why. It's time to take a stand. It's time to step out and let your voice be heard. And you can do it on this site. Let your voice be heard. What do you think, one way or the other? Take a stand. Look at the risk benefits. Are we creating another chronic disease here? Should this be pulled off the market like so many other things? And why isn't it being done? The time is now. It's time for all of us to serve other people, to be servant leaders. And we can serve others by taking a stand, saying what's right, standing up for things. Well, I'm going to stand up for something today as well. In my opinion, if you ask me, should the mRNA vaccine be removed from the market in its current state right now, I would say, in my opinion, the answer is yes. It's time. It's time to do something. It's time not to sit by. It's time to take control of our health. It's time to ask, why are these things happening? Why aren't people doing something? Why do we have so much chronic disease? The time is to find the answer, to look for the reason why, to look for solutions to the chronic healthcare dilemma. And every time I look for answers, it leads me back to this: the Bible, the source of truth, Christ, the key to health and healing, the key to knowledge. And in this verse here it says, "But he who is greatest among you shall be your servant." Lord, teach me how to be a servant. Teach each one of us how to be servants. How do we serve each other? How do we serve our fellow man? How, in this time in world's history, do we make a difference? Do we find a way to glorify you and help to serve our fellow man and give them hope and give them the source of healing, the real reason why, the real solution to chronic disease, the real solution to the mRNA vaccination dilemma. Let's take action today. Please leave your comments below. We're interested in knowing what you think, sharing, be nice. We want to pray, but we want to also press urgency. It's time to take actions in our own world. It's time to pray for each other. It's time to get control over your own health. It's time to turn back to the real solutions to our healthcare dilemma. Well, give this a like, share this with your friends. I'm hoping that I don't have to continue to talk about this topic. I'm hoping not burdened with this. I'm hoping we can move on to other things. But you know what? What is more important than moving on to the Bible, the source of truth, and letting Christ be the center of our lives and transforming us? More on that in another time. I'm Dr. James Marcum with this biblical prescription for life.